A warm welcome to the MADI Prosthetics Education videos. The following film is intended to provide you with tips on assembling a leg prosthesis for a user whose lower leg has been amputated. This is no substitute for proper training as a prosthesist. Determining the correct prosthesis liner. Before you assemble a leg prosthesis, you must first select the correct prosthesis liner. This connects the prosthesis and the residual limb and should be done when assembling the socket. Ask the patient to stretch out the residual limb and measure 4 centimeters from the distal end upward along the leg. At the level of this point, measure the exact circumference of the residual limb and make a note of this. Don't let the measuring tape cut into the leg. Check for bony structures in the stump, such as the end of the fibula. This must be considered when determining the point of measurement. In this case, fix the measurement point further than 4 centimeters from the end of the residual limb. Now you can select the liner size. The correct MADI liner should then be 0 to 1 size smaller than the measured circumference. Here's an example. Measured circumference 27.9 centimeters, use a 26.5 centimeter MADI liner. Important, the user's indications are decisive, for instance, soft tissue situation or user acceptance. After the size, the right length of matrix must be selected. For this, you have to measure the distance from the end of residual limb to the fibula head. If this measurement is 10 centimeters or less, a 5 plus 3 centimeter matrix must be selected. Otherwise, use the MADI liner with a 10 plus 3 centimeter matrix. Important, the selected matrix must not protrude beyond the fibula head. Applying the prosthesis liner. The liner has been ordered and has now been delivered. First, explain to the user how the prosthesis liner works. Then show the user how to apply it. Turn the inside of the liner outward. Turn it until there is an even area at the lower end. Apply the liner so that the whole area is on the distal end of the residual limb. If this is not possible, perhaps because the residual limb is split, this can be corrected with silicone pads. You should also allow for any soft tissue that may be protruding. Apply the inverted liner to the end of the residual limb without using pressure. Take care that the liner pin is at the level of the residual limb axis when applied, that is, on the axis from the liner to the residual limb. Push the liner up to the knee, but avoid folding. Then slightly bend the user's knee and push the liner further over the knee. Take care not to roll up the liner, but push it upward. Otherwise, there may be too much stress on the skin of the residual limb. Now push the inverted section of the liner completely upward and smooth it down. Check for pockets of air or folds. If pockets of air or folds have formed during application, you must repeat the process. After the liner has been applied, ask the user to move the residual limb back and forth. This serves to check mobility and comfort and helps the user to get used to the liner. Fitting the prosthesis liner. After being correctly applied, the liner must be cut to the correct length. Measure the applied liner to at least 10 centimeters above the patella in order to determine the correct length. Make a mark on the liner for the cutting position. Use scalloped edge scissors for the cut. Take care that the cut is evenly scalloped. The scalloped edge enhances the liner's stability and releases pressure on the residual limb as the circular pressure is reduced. The risk of skin reddening is reduced. Take care not to cut the liner matrix. Workshop assembly. When the prosthesis socket is ready, the fitted parts of the prosthesis must be prepared. These are selected according to the user's body weight and mobility. A typical lower leg prosthesis consists of a silicone liner, the prosthesis foot, a tube adapter, the necessary adapters to connect the fitted parts. Proper shoes should also be recommended as these support the performance of the prosthesis. The prosthesis assembly should start on the workbench with the shoe. The heel height of the shoe must be allowed for. Insert the prosthetic foot into the shoe and connect the tube adapter to the prosthesis foot. The prosthesis foot should be secure and straight in the shoe. When tightening all the screws, pay attention to the tensile force in Newton meters, as given by the manufacturer. Then connect the ready prosthesis socket with the tube adapter. Once all the prosthetic parts have been combined, the adjustment of the prosthesis can be continued. Use a laser plumb line for this purpose. In the first step, the prosthesis is turned slightly outward. The socket stays in its starting position and the prosthesis foot is turned slightly outward. The laser plumb line then passes through the big toe and the middle of the heel of the fitted foot part or shoe. You can then continue with checking the frontal assembly. If the prosthesis is correctly assembled, the plumb line should run at the height of the patella ligament medial lateral at a ratio of 50-50. When checking the sagittal assembly, care must be taken that the plumb line passes vertically through the tube adapter. The heel height of the shoe must be allowed for. At the level of the patella band or the plane of the entry of the socket, the anterior and posterior should be at a ratio of 60-40. During the workshop assembly, it's important to consider the individual position of the patient's residual limb, for example if there's a bending correction. Depending on the angle, it may be necessary to adapt the prosthesis assembly by displacing the socket. In any case, this basic structure must be checked during the dynamic fitting and corrected if necessary. Static fitting. If the workshop fitting has been correctly performed, you can continue with the static fitting. After applying the prosthesis, check the sockets fit. Then, adjust the length of the prosthesis. Ask the user to stand up. Ask him how he feels and check what he says with a pelvic scale. If there is pelvic obliquity, the prosthesis length must be adjusted. To determine the correct prosthetic length, use distance boards to balance the length of the legs. Place the contralateral leg on the first distance board. Ask the user again how he feels, and check this with the pelvic scale. Repeat this process until you've determined the correct prosthetic length. Then adjust the length of the tube adapter with a suitable tool. Apply the prosthesis again and check the outward rotation of the prosthetic foot and the sagittal and frontal orientation of the prosthetic components. Place the residual limb on a raised object so that the prosthetic leg can dangle freely. Always use a walking support for this. Let the prosthetic leg dangle. If the prosthesis foot extends too far outward, an adjustment is necessary. The user sits down again. Then release the set screw of the screw adapter and rotate the foot into the desired position. It's recommended to use markings as orientation. Then tighten the screws again. In addition to the outward rotation, the position of the foot parallel to the contralateral leg must be checked. In other words, is the foot too far backward or too far forward? Please bear in mind that the following measures to correct the sagittal malposition should only be used if the malposition is only slight. An additional adapter, such as the Mady sliding adapter, can for example be used for major malposition. In this therapy, the prosthetic foot is too far forward. Open the front set screw between the tube adapter and the pyramid adapter on the prosthesis socket. Then tighten the back set screw to the same extent. This imparts an inclination to the tube adapter. Then open the back set screw between the tube adapter and the foot pyramid. Then close the front set screw. The tip of the foot is then pulled up again. As a result of these two movements, the prosthesis foot is pushed slightly backwards. When the foot is in the correct position, tighten all screws in accordance with the manufacturer's instructions. The static fitting is now complete. The key points of the static fitting will now be repeated. Check the fit and position of the prosthesis socket in sitting and standing. Determine the correct length of the prosthesis. Adjust the outward rotation of the prosthesis foot and the sagittal and frontal orientations of the prosthesis components. Once the prosthesis fitted parts have been fitted, these will work together correctly and the wearer can walk properly while conserving his strength. Dynamic fitting. Once the static fitting has been successfully completed, the dynamic fitting is performed. The user walks at different rates in different situations. For example, the user walks in curves, uses a ramp, climbs stairs, or walks on different surfaces. The prosthesis assembly and especially the settings are checked once again very thoroughly and readjusted if necessary.